women come to us feeling not like themselves. They feel like they don't even know who they are. They are having issues at home. And then we work together. And then all of a sudden they're like, I'm feeling myself again. Like my family has noticed.
It's our generation right here. We have to be the ones to change it for the younger girls. Hi, everyone, and welcome to Take a Pause with Mare, where we will celebrate the pause in all her glory and not so glory. So grab your coffee and get ready for a conversation that's honest, real, and maybe a little bit funny. Yeah. Today's episode, I have the honor to have Raquel again, who is the founder of and the creator of Menopalz.com. And hello, Raquel. And with her, we also have Giselle, who is founded the Women's Institute for Specialized Health. And she is also a vetted nurse practitioner and menopause coach on Menopause. So welcome, ladies.
Thank you.
Thank you.
So today, let's talk about the pause, basically. And
The pause. Our favorite topic, isn't it?
And how, well, Giselle, what's your journey been and how you have started and everything like that? We want to hear all about you.
Oh my goodness. So my story started a while ago. I always wanted to be in medicine, became a nurse, worked in the ER, loved it. But oh yeah, it was pretty fun.
I'm sure you've got some stories.
I do. Never had to turn on the 10 o'clock news. I worked at a trauma center, so all the stuff came in. I was like, oh, that's going to be on the news in about an hour. But
That's awesome.
it was, I love the adrenaline, but there was some stuff that, some things that came in that just didn't sit right. And so, I wanted to make a shift. And so I went into women's health, labor and delivery, which was still kind of like an ER setting for moms and babies, right? Still in the same level 1. So we got the sickest of the sick and did that. And I enjoyed it. I've worked almost every aspect of maternal child. And
how long were you in labor and delivery?
For about 8 years.
Oh, wow. You saw some things.
Oh, yeah.
Holy moly. Yeah.
Saw a lot of stuff. And I remember one time, one of my girlfriends, she's like, hey, let's do some traveling. And I was like, traveling? We live in Fresno. I have a family. Where am I going to travel to? So anyways, they have local, agencies and then obviously travel. And I was like, well, I can't leave my family. So it's just going to have to be local. So I worked in a rural community in Reedley. And it was, talk about, 32 miles away from Fresno, the main level 1. And so quaint community, really cool, learned so much. And I was out there for, probably about 2.5 years. And then they hired me on as a resource nurse. They wanted me to be part of their community. And one of the doctors that I worked with, and I'm going to tell you, I still keep in touch with him. He's the reason why I am. I'm going to say it. He's the reason why I am where I am. I remember one day he came up to me and he goes, I want you to go back to school. And I laughed at him. I said, I'm never going back to school. I'm not going back to school.
Amen, sister. Amen.
Right.
Your nursing response. Well, honestly, that is like a nursing response. Like, nope. Went for nursing school and you're traumatized. You're scarred. You're scarred
for life.
Totally. Right. And so, he said it, he goes, I'm going to pay your way. He didn't pay my way, but,
darn it. I was all excited. I was like, oh my God, tell me more.
But let me tell you, he was amazing, an amazing boss. I was like, no, I'm not going to go back. I'm not going to go back to school. And so I ended up, going back to the hospital that I worked at registry wise. And then I signed on as full-time staff. And, I ended up getting pregnant with now my 16-year-old daughter. And I remember telling my husband, I'm like, I need to do something more. I want to do something more. And then there's Dr. Kano's voice in the back of my head going, you got to go back to school. And I was like, oh, I don't want to go back to school. So anyways, I ended up having I told my husband, I said, I want to do it. He goes, babe, you're pregnant. You're not, no, come on. I mean, that's just a lot. Like,
y'all, it's the best time. I can sit and study.
Right. I know. Right. And he's like, you have problems with your pregnancies. Like, do you really want to take that on? And I was like, I don't know. Anyway, so
So I did. Yes. So she's so
right. So
confident.
yeah, so actually it wasn't until after I had my daughter that I ended up having a breast cancer scare, and it was pretty bad. And
Oh
so like
no.
I had to go get biopsies and all this other stuff, and it kind of threw me into a depression. And so my husband came home one day and he's like, "So what'd you do?" And I was like, "Well, I fed the baby, took the boys, got them off to school, and I applied for grad school." And he said, "You did what?" And I said, "Well, I want to go back to school. I want to become a nurse practitioner. So I applied for the program." And he goes, "Of course you did." and, and, and I said, "I don't know how, I mean, I don't know." He goes, "We'll figure it out. We'll figure it out." So anyways, I went back to Fresno State and got my family nurse practitioner, not my women's health, because I wanted to be able to take care of the lifespan. Right.
Okay.
Yeah.
So once all the doctors caught wind of that I worked with alongside, I remember being cornered in a C-section by a midwife, and one of the doctors going, "So when you graduate, are you going to come work for us?" And I was like, "No, I'm doing family practice. I want to really, I
Uh-huh.
want to learn." And so,
This is great.
it's amazing. And then again, Dr.
Meanwhile,
Kano,
ladies laying on the table waiting for
I
a
know, right?
C-section.
No, no.
Baby's
Take the
out,
charge.
it's
Are you
fine.
kidding me? We got her. We got her. So anyways, then Dr. Kano caught wind. And so I said no. So I ended up working 38 miles away in another rural community in Mendota at an FQHC, where I saw the sickest of the sick. Like
Wait a minute. So tell me what an FQFC?
a federally qualified health clinic, right? So
Okay.
like,
And in rural America, those are really tough.
Yeah.
My folks live in a really small town in Oregon, so getting any kind of services is really hard. And so to have somebody that had like knowledge and background, they were like,
Yeah.
"Oh, I'm sure."
So, but I was a novice. I came out fresh from, but I, they're like, "Yes, come work."
Yeah.
And,
Yeah.
I learned so much. Like I learned diabetes, high blood
Oh,
pressure.
yeah.
I learned the sickest of the sick. And so anyways, I did that for a good solid year, and the drive was kind of a lot. And so I moved closer to home and worked at an OBGYN's office. And then of course, Dr. Kano reaches out to me.
Coming
He's
in
like,
hot.
Oh, finally.
he's like, "Listen, I've given you enough time." And so anyway, that's what started my woman's health journey. I went back into women's health at that time, knowing that I was going to be able to learn. So I had the labor and delivery, I had the postpartum part of it, the intro part of it. And now it was like, okay, well, let's get down to the nitty gritty and really learn about antepartum, like what these women go through, and then the gynecological part of it, right? And then the woman's health, like hormones. So I've always said that OBGYN should be two different specialties, because it really should, right? We have obstetrics, which is all
So
baby and
specific.
yeah, and then we have gynecology, but
which is also very specific in its own right.
absolutely,
Yes.
absolutely, right? But those two cross, and so anyway, so I did that, and I worked for Dr. Kano for many years, and then I moved closer to home in Fresno, and worked at Central Valley Women's Health Associates with Dr. Bosch and Dr. Mason, who actually was my OB, which was kind of fun, but it was amazing. It was amazing. And then we ended up moving out of California. Yeah. I mean, but I learned so, like that's the beauty of this profession, and the beauty of being in women's healthcare is that there's a lot to learn, and treating women. It wasn't until I moved that I realized what disparity there was for women's health, in the fact of in the eyes of hormone replacement therapy, right? Because my patients were getting hormones. They were getting hormones. I was talking to my pharmacist. My patients were happy. They were getting estrogen, progesterone, testosterone, right? And so it wasn't until we moved out of California and I started working for a couple of platforms that I was like, "Oh my gosh, wow, this really is an issue." Like because in my little bubble, my patients were happy.
Right.
Well, that's true. That's what a great perspective though. Like because you weren't really seeing the
I
side.
wasn't.
Yeah, you were just kind of in your little
Who's doing it?
fishbowl doing, yeah.
Yeah. And it was funny because I would have a couple of patients come in and they would say, yeah, I'm reading this book. And at the time it was Dr. Mary Claire's Galveston diet. Right. And I'm like, oh,
Oh,
that's great. Yeah, I said, and I would tell them, in this time period, this is what we want to focus on. And they're like, well, that's what she said. I'm like, okay. Like, I didn't know what to, I was like,
okay.
I was like, okay, well, this is what we're going to do. Let's do this.
So we're
anyway,
both in the medical field. We both kind of said the same thing.
Yeah.
But again, I think I really contribute my knowledge that I gained as family practice, right? And learning about diabetes, high blood pressure, cholesterol, all of those, and then really incorporating that into women's health. Because I mean, eventually we may have that, right? Yeah. And now understanding the roles hormones play in those disease processes, it makes sense.
Because there's actually, I read somewhere, and when I read it, I reread it because it had mentioned how they feel like menopause should be treated as a whole body.
Absolutely.
No, not just you go to just in GYN, like you have a cardiologist who is aware of it and everything that you were actually doing authentically, just not, just looking at the whole picture. That's how they feel like menopause should actually because it affects everything. So it's affecting, it is doing like endocrine, it is doing the cardiology, like everything.
So again, perimenopause, menopause, hormones, those hormones really do play a role in how it affects every organ system. It plays a role in how our body processes disease processes or how it affects us, right?
Yeah.
Dr. Lisa Mosconi, she's brilliant. She's the one that did the menopause brain, right? And she said it truly is an endocrine neuro transition state. Menopause is, because it affects the whole body. But I have always taken, and that's how I've taken the approach at Women's Institute for Specialized Health, is a very much integrative approach, because it affects everything. And this is what I say to all my patients when they come to me and they're like, I'm having all these symptoms. My primary doesn't know, I've been to, and this is what I say, they get sent to all the ologists, right?
Yes.
Cardiologist, neurologist, endocrinologist. They get sent to all the different.
The sad thing is the ologists don't sometimes connect the dots. Like for an example, right? My mom has some stents in her heart, and I'm like, I've read research that the stents in her heart are probably causing some kind of dementia, and if you put a stent in her heart, you should be really working with a neurologist very closely. And they're kind of like, I don't understand why. I'm like, am I the only one that read that?
Well, and it's unfortunate, but gone are the days where you can, unless you have a service that offers that, like Women's Institute for Specialized Health, gone are the days where you can sit down to your provider and your provider can actually say, yeah, let's talk about this research article that, you know what I mean? Because everything let's go. Yeah. I used to have a patient that she would come in, she knew her body and she knew what was going on and she did the research, and I would walk in the room and she would have all the research articles laid out. She goes, I printed these all out for you. I want you to read these. And I'm like, you've done your research. That's how the patient now has to be prepared to have these discussions with their providers, unfortunately, right? So I always tell patients, do your homework. You've got to do your homework. And and bring stuff to the table, because we can absolutely talk about these things. We can chat about this. And that's the approach that we should be taking, right?
It is. And that's exactly why Menopalz is such a huge piece. And I saw the need for that because, we're getting into these 15 appointments. We're not prepared. We're just kind of like, oh my God, we're just so happy to see a doctor. And please just help us because we feel X, Y, Z. And sometimes we don't even remember what the heck we're talking about or what we heard, So menopause was just to bridge that gap so that you have the resources, you have the education piece. And when you get to the doctor, you can advocate for yourself. And like you've always said so eloquently, be the CEO of your healthcare.
Yeah. I've always said, and I always tell patients, because I've had patients sit there, and I know we spoke about this previously. I've had patients who are like, well, I'm sorry. And I'm like, why are you sorry? Well, because I may be challenging you. Please do. I want you to challenge me. Like, don't be sorry. This is your health. Like,
I
want
appreciate you so much for that.
I know, but thank you. I say thank you also because
Mhm.
that is for the majority what women aren't experiencing. Like
Right.
we were very encouraged and like very like made that woman feel like, hey, you did a great job. I went into an appointment and I did have the Mary Claire Haber book, The New Menopause.
Good for you.
Oh yeah. No. No.
No.
I'm holding the book like it is everything. And I have all these different colored tabs sticking out of everything that I want to talk about. And I was like, oh, these symptoms, let me go to the green tab. And I was like, and no, it did not go well because I don't know if the vibe was that I knew more than her or I was like
challenging her authority or something,
exactly.
maybe. Yeah.
Exactly. And it did. And I ended up feeling I left there, unlike your patient that left with you, felt like, great, I did the work. This is so good.
Felt empowered. Right.
Yeah. I left there thinking, wow, I know less now. And all the work that I did sort of felt like it was for naught because
it's a little deflating. It's deflating.
It was deflating. I was
a lot of deflating.
Yeah. And then I was like questioning and I was like, well, now I really don't know. I thought I knew. I was going in there so prepared. I thought this was it. And then her, I was like, I really think I need to get some labs and blah, blah, blah. And she's like, we're not going to draw any labs. They're going to be low. And I'm like,
yeah, okay. So that's another thing. And I'm going to tell you, because historically we've always said, well, we don't need to, we treat based off of symptoms and not numbers. But I always tell a patient, knowledge is power. If you want to draw your labs, and I premise it, I'm like, I can tell you they're probably going to be low.
Right.
I can tell you what they're going to be, but
and that's fair though.
Yeah.
That's completely fair.
But let's do it and gain some knowledge, right? Let's see what this is. And it's so sad that especially a female provider where they are, instead of straightening the crown, they're tearing it down, and they shouldn't. And that's what I always tell patients too. Like, we need to be in this together. We shouldn't be tearing down each other's crowns. We should be straightening them and going, come on, let's figure this out. Let's do this.
And I absolutely love that because that is the mindset that should be had.
Absolutely. A partnership with your doctor is like a true partnership, right? Where you actually can like get things accomplished, because you're, as a provider, I'm sure you're in it to like heal the person, and the person is there for the help or the healing.
And that's what it should be. It should be a partnership, right? Like I said, it should never be utilitarian. Like, you've got to do this, you've got to do that. It's coming up with a plan, discussing it, giving, you guys are the pilot. I'm the co-pilot. I give you the information, we talk about it, and then we decide what's best. Now, obviously, if you come back and something's not working, then at that point we may say, hey, remember I discussed probably trying this option. I think it's probably time to do that. Then we can do that. It's still very antiquated, the way that we are treating women during perimenopause and menopause, which is frustrating. But I seriously think that we're going to be on the right path. Another topic, which I think we've spoken about this in the past. I mean, testosterone, right? Like,
right. Oh,
I used to be a clinic director for a testosterone replacement clinic for women, specifically for women. And now testosterone's
here in this universe, like it was here in this universe, right?
Did not be born on Mars.
It was here. Yeah, it was here.
The Keystone State of Pennsylvania, that is a definite not a topic that you can even talk about, get, or anything. It is like such taboo. It's like crazy. And even if you go onto other websites to try to get it, the one thing that clicks you right off is they ask where your location is. And once I put in Pennsylvania, I'm like, oh, this ain't going to be good. And it's, so
It's very frustrating. It's very frustrating as a provider. But think about it though too. Like we still think that the word estrogen and progesterone are bad words though too. Right? Now we're throwing in testosterone and people are like, oh my God, that's a male's hormone.
I'm gonna grow facial hair.
Yeah. It's a human hormone. And if you know
Mm.
how to properly manage it, then we can minimize those effects. And I tell patients all the time, I'm not here to, that care is a different kind of care. I don't know how to do that. That's a specialty. I'm here to replace what has been lost.
Yes.
Right? Like in our early 20s, it's the most abundant hormone in our ovaries, more so than estrogen and progesterone. Think about it. Back in our 20s, we had the vitality, we had the energy, we had the sex drive.
We had the sex drive.
Yeah. But we had all that. And early 20s, late 20s, excuse me, early 30s, it starts to decrease. By the time we're 40, most women have low testosterone. By the time we're 50 in menopause, we're just still skating along with low testo, but
definitely skating along. Party of one.
Party of one. I know. Let me tell you, is
fallen off and they've broken. That's how they're off. I don't even know where to be somewhere.
Right.
If you find it, let me know.
Listen, I tell patients all the time, it can be and within reason, right?
Yes.
Like I say it to patients. Maybe it's not for you. Maybe testosterone's not the hormone for you, right? Maybe estrogen and progesterone aren't the hormone for you. We won't know unless we try. For some, it can be life-changing, and for others, maybe not so much, just like estrogen and progesterone. But there have been some good that have come out of it, and especially for women's health, knowing osteoporosis. I mean, osteoporosis, we don't even start screening until women are 65, which is ridiculous. But
it's very true. I tried to get a DEXA scan and they were like, your insurance won't approve it because I wasn't 60.
That's ridiculous.
I'm 57, but I'm like,
but then that's when you sit there and say, you know what, I'll take my chances. Let's try it and order it for me.
Yeah.
Because again, you have to push. You're going to have to push and say, no, I want that. I deserve that. Because what happens is there's a lot of other things that can affect bone loss, right? And if we're not, so it should be 5 years post-menopause or at the age of 65. Those are the guidelines. But a lot of people are missing the 5 years post-menopause, right? And they're just saying,
a lot of people don't know that they are postmenopausal until they maybe see a doctor's note like Mare did. Yeah, like they're never given those words. I mean, menopause, perimenopause, none of those are coming. That terminology is not coming up when you're sitting down with your GP, your general provider, because like that's just not on the docket. Like, you go in for like palpitations and they're like, oh, go to the ologist, go to the cardiologist.
Cardiologist.
Yeah.
All you needed was probably some hormones and some magnesium and you'd be fine. But
possibly,
yeah. But
that did happen to me though, in the sense, like I did not know that for 10 years from like 46, I was, having the palpitations, went for the, the Holter monitors, blah, blah. I never said perimenopause, never said menopause. I go and I'm reading my summary, like the office visit summary. And it just said 56, it was last year at the time, 56-year-old postmenopausal woman. And I'm like looking around, I'm like paying my copay, like, where'd the peri and the meno go? Did I'm a senior now? Wait.
The lady at the desk, I don't know. Do you want to come in on Tuesday?
She's like, I don't know, ma'am. You're going to have to ask your provider that question.
Is that 8 or 11 a.m.? What time works for you?
Yeah, but I mean, the 5 years after menopause for that is, you do have to know, but that is something that can happen to women way before 60.
Oh, absolutely. Absolutely. And let's talk about the other stuff that happens to women,
During?
And what'd you say?
During?
Yeah. Like another thing that really gets to me is, women come to us feeling not like themselves. They feel like they don't even know who they are. They are having issues at home because their husband's like, I don't
Yeah.
know. I don't know what's happening.
Like, are you an alien now? What am I
Yeah,
married
like,
to?
yeah, which during this time there is a high divorce rate and separation rate
There is.
because we are not who we once were, right?
100%.
Telling a patient to go home and have a glass of wine, or telling the patient that,
I'm all
there's
for
really
that.
nothing that we can do for you.
Mare, what's in your mug, Mare? What's in your mug?
Write that down.
Listen, there's nothing wrong with wine every once in a while, but
Mare's sipping the wine. She's sipping
Oh,
the
it's
vino.
every once in a while. That's
that's the
that's
key. Just messing.
the
I'm
key.
messing.
right. Well, but when you go to a provider and you feel like the water line's right here, and then they say those things, and then all of a sudden your head's below water, you're like, thanks, never mind. There went that.
Mhm.
But there's, women's health is it's complex,
Mhm.
right?
Very
It really
complex.
is, because then we add something else that's complex on top of that, which is the topic of low libido or hyposexual desire disorder. Oh my God, you want to talk about complexity? Some people think, oh, just throw testosterone or throw this at there and it's going to be fine. Oh, no, 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 no. Because there's different cogs in the wheel that can affect libido and hyposexual desire disorder. It very much is a biopsychosocial thing. And it's all encompassing. It's all encompassing. So this time in our life is we need to have somebody who can have those conversations and take the time with patients, and having Menopalz that can gap that, bridge that gap is so important,
Thank
because
you.
of course, because again, it can't just be the work of one. It takes a community, right?
It's a
It
whole
takes
village. It's just like
It is.
raising kids, except for now we're focusing on us, not everybody else.
well, it's kind of like older adult kids, puberty in reverse is what I say menopause is. So it's
Oh, it is. Like as if
yeah.
puberty, as Raquel was saying, as if puberty wasn't bad. Like that. I mean, my
Good God.
but it
But
is
the
a
whole
community.
lifestyle part is like where, like I think, like Mary, correct me if I'm wrong. I feel like we're really accountability partners more than anything. Like you come to us, you talk about the things that you want to change. You've had a great, healthy conversation with your doctor. And it's like, okay, now I'm going to work on, my workouts. I'd like to work on eating. Obviously, we're going to ease into those things. We're not going to be like, change your whole life, swipe the table. Like, let's
Right.
make a plan. But yeah, you're right. Like we have to have a full encompassing plan, and somebody there that's going to be like, hey, did you work out this morning? Because I know if I know people are there waiting for me and I'm not getting my butt out of bed, like I feel guilt. So to me,
Right.
that's like, okay, I'm going to get up and I'm going to do it, or I'm going to get up and I'm going to go to this cooking class, or I'm going to jump on this Ask the Provider, Q&A, so that I can, equip myself to have better outcomes all the way around.
Yeah. I think it is like them. You need that, how you say, like menopause, it's having a pal. You do need that girlfriend, that pal, because you'll get everything. Even if you've done your research, you're like, okay, I have to eat better. I have to do this. I have to decrease alcohol. Well,
I've had to cut alcohol completely.
You do know all that, but then now you're exhausted. And now you're like, I know I have to eat better, but I don't have the energy to make my 6 ounce of protein and my vegetable. I'm just going to have maybe 4 Oreos and just go to bed. You know what I mean? So you can
guilty. I have done it. I've done it. I'm guilty.
But do you know what I mean? But at least though, if you go someplace like you with menopause, you can be like, hey, check in. Like, hey, I didn't do so good this day.
Yeah.
And it's okay. You're like, you know what? You're checking in. So you are choosing yourself just by coming here and choosing to talk with somebody. And then the next day will get better, as opposed to just trying it and then saying, I couldn't do it. And then you're down that rabbit hole.
Yeah. And we're always so grateful for providers like you, because you like, Giselle, you listen and you take the time, and it's such a great synergy, like I know personally I've sent so many people to your clinic, because to me, it's like, hey, she takes the time, she listens, and she's got her thumb on the pulse of like the actual like thing that's going on inside of you. This isn't just, another GP that's going to say, hey, here's an SSRI, have a good one. I don't believe in giving out hormones, which is, I hear so often, like, oh, you're 66. I don't believe in giving you hormones. You're past that. You know what I mean? Like, you're not
That's
past that. You were
number.
born. Yeah, you were born with hormones. How do you mean you'd have been past them?
Yeah. Exactly. So it is, I mean, that is the encouraging, like, you are definitely doing that. It's, it is so hopeful and gratifying. And so I say thank you so much for doing that, because the lives of women, like, they may not even know how lucky they are. Have them watch this podcast and look at, well, we're telling you, if you were in PA, you'd be like, "Can we get Giselle here?" I
know, we're like,
do you know what I mean? I mean, it's not like, you're trying to figure out what's right for you. And then you realize, depending on what state you are, you'll have different, requirements and different, and it's like, oh my God, it's like every berry, you're like, oh, I'm going to do this. And then like, oh, no, you can't. And oh, I'm going to do that. Or the black label is still on, which supposedly will be changing.
Yeah, they're eyeballing it, maybe 2030.
I know. Well, it takes so much to just get things changed, which I don't know. I think it just depends on, there's things, but
there's layers.
There's layers, but but again, empowering the patient and saying, hey, I mean, within reason, if a patient comes up to me and says, I want this prescription, I'm like, okay, what do we want it for? Let's talk about this.
Right.
Mm-hmm. Like within reason. Right. But every provider should sit there and say, oh my gosh, yeah, why let's prevent UTIs and urosepsis from happening. Let's give women vaginal estrogen cream. Why not? Like
So now I need to know, what is urosepsis? Is it urosepsis? Yeah.
Urosepsis. So untreated UTI that can go into the kidneys, that can become systemic, right?
Okay, so this is where you become septic.
And there's catheters, indwelling catheters. There's so many women that, and not just women who have indwelling catheters, right? Like women who have genitourinary syndrome of menopause that have absolutely no estrogen there, right? The vagina, the vestibule, and the bladder are inundated with estrogen and testosterone receptor sites. Let's put estrogen there. Let's get those receptor sites occupied, so that way we can help plump up that tissue and prevent infections,
Right, because unfortunately it's not until you're having a problem that you realize, that's what's happening.
And not only that, think about how many scripts are written for UTIs, right? And those are antibiotics. That's messing our gut. We need our gut health, right?
Yes.
So why aren't we doing preventative stuff to help prevent that from happening? So.
No, that's a good point. Preventative meds, I think, are something that's so overlooked as well. I mean, I think it's just like you said, like people don't come in until they're symptomatic. And then once they're there, it's just like a whole host of things. And then they go too far overboard. It's like, oh, I'm going to give you this. I'm going to give you this and this. And then you walk out and you're like, what in the hell just happened in there? Like you don't know. Like, and then it's like, now you have 700 prescriptions, a nice little note from the doctor of a summary, and no direction. Like, what do I do with all of this? So that is, again, why Menopalz and people like you are so important, because we need to educate women on what is happening out there. You know what I mean?
Yeah, absolutely. Absolutely. It's, I want to say I'm hopeful that things are going to be shifting, right? I'm hopeful. Yeah, exactly. But going back to that WHI, that just did such a disservice for so many women. And so for generations of women.
Yes.
And again, going back to, unfortunately, we live in a litigious society, right? And so a lot of providers are like, no, I'm not. I had a patient tell me, she's like, my OBGYN won't prescribe me medication because she doesn't want to get sued. And I'm like, For what? Like, if
So
you guys if you have informed consent and you speak to the patient and you tell them the possible risks, even though the risks, you know, are low. But yeah, there's a lot of women that aren't getting the proper treatment
there
because of
is
that as well.
so many. We, on the Take a Pause, we did an actual episode on things that your GYN told you, like in the appointment, right? And it was, for me, it was so demoralizing to have these poor women. I mean, I had a situation where, you don't get the answers, you walk out, you're infuriated. But on so many other people are saying how they refused to give them. They went in there like, and they were like, I want this. They refused. And now they walk out like, do I go to my family practice doctor? How
Right.
can I
And then the
get
family practice doctor says, "Oh, that's for OBGYN."
no,
And then they're like, "But I swear I was just
one?
there." And they
Yeah, right.
said no.
And then
And
they're
it's
in the
like they have a system,
there.
but the system doesn't communicate. Like
Right.
we have my chart. I don't know if you guys have my chart, but like we're in
Oh,
my
yeah.
chart. We're like,
Yes.
but they don't communicate. It's like nobody reads each other's notes. And I'm like,
No.
so it's my responsibility as the patient, because I want to heal, to say, hey, look at the notes for this guy, or did you see what this person did, or did you check out that blood? Because otherwise we're just like flying blind all the way around.
Yeah. It's very true. And it is
Mhm.
my chart. That's who we had. But
Is that,
it's,
yeah?
yeah. But they can't, like, you can message your provider, but they can't see everything that's going on.
And who's the
Yeah.
gatekeeper when you message the provider, right? Like it's
yeah.
like their I don't know, assistant or whatever, and they're like, well, this isn't really high priority. Off you go. So then you're like at the bottom of the barrel again. Meanwhile, you're freaking out inside, like I need to talk to somebody. It's tough.
Yeah.
It's
So I
really
mean, it
tough.
is like things that you're told that you go in there, hoping for the best, and then you're told, just horrible things from
Yeah.
somebody that you're like, okay, I don't know where else to go from here. So it's
Right.
great that you actually founded your Women's Institute, that people can, and you're online, right?
Yes.
Yep.
And tell us a little bit about Wish, because
Yes.
I know myself, because I send, like I said, I send clients to you all the time, because I believe like your system and how you approach medicine with them. I really stand behind that. So tell us a little bit about Wish, because I'd love other people to know.
Yeah, so that you can leave the office and you're like, okay, well, I know 2 websites that I could go to. Menopause, I wish that I can be like, let's talk, girls. I
Yeah.
just
Yeah.
I just
Let's talk.
really got thrown out of a GYN office.
Yeah, because that's when you're most fired up, right? When they piss you off, you walk out and you're like, that's it, I'm finding something else.
Yes. Wait until I get that. How was your just wait till I get that.
So just to be fair, though, I do want to put this out there, though, too. Just to be fair, like a lot of these providers didn't even get proper training in
Right.
menopause.
That's what I found. I had no
100%.
idea. It's just with starting to do the research
Yeah.
and just asking. And
Yes.
it was actually, so my general practice, like family doctor, whatever, he was the one that told me, oh, we don't get, and I was like, well, okay, well, sure. Because he's a, family, physician. Sure. So then I go and I ask my nurse practitioner that I was seeing at the time in GYN, and I was like, is this true? Like, this can't be true. And she's like, oh, it's true.
It's totally true. My program for family practice right now, had I gone down the pathway of women's health nurse practitioner, that would have been a different story. I don't know how much menopause training they have in there, but as family practice, women's health was an elective 4 Saturdays out of the month. That was it. I took it because I was like, well, it's an elective. I get, but again, my background, I was coming from a lot of women's health, but I wanted to see, but it didn't really, it didn't give us that. It didn't give me that much. So all my training, everything that I have learned, I have self-taught, self-learned. I've gone to wonderful conferences. I've gone to, I've become members of certain societies. So that way I can gain that knowledge and I have access to that.
All I hear is like, you're responsible for repopulating the earth. However, it's an elective to learn about your health.
Yeah. It's an elective to learn about 50% of the population who, but it's shocking, right? It really is shocking. I created Wish knowing that again, it wasn't until I moved that I realized that there was like this disparity, right? And I was like, and I found it even like I recognized it in when I was the clinic director of the testosterone replacement clinic as well. And I would talk to patients and they're like, yeah, my OBGYN won't prescribe hormones. And I was shocked. And so I just thought to myself, wow, like that needs to change. That really needs to change. I'm licensed in 34 states. I'm actively practicing in 26 states.
Nice.
So patients have that, depending on the state, right? Have the
Yeah,
accessibility.
right.
Right. But I wanted women, I didn't want to just focus on one thing, right? I wanted to focus on the whole patient because it affects the entire body. It affects us as a being. And so I take the integrative approach, functional med kind of approach, optimizing, and looking at all the different organ systems, right? Because it affects that.
Yeah, 100%.
Right. So not just hormone replacement therapy, but overall health, right? Preventative medicine.
Right.
Looking at sexual wellness. Sexual wellness is something that I love to help patients with and teach patients with, especially when women who are in their 40s are like, I've never had an orgasm. What is that?
Oh,
And
sweet baby Jesus, no.
Let's teach you, right?
No, not at 40.
I call a Bob. Battery operated boyfriend.
Well, listen, I had that conversation with one of my patients. When we talk about libido issues or sexual
I can't get over Bob. I'm sorry. I'm trying to pull
that was a well-known term that everybody, you got to have a
pull
Bob.
it back together.
I encourage patients to have a Bob because it's cute, right?
Ladies get a Bob.
Yeah.
And not that choppy haircut.
But there's disparities. I had that conversation with a patient. She was well into her 40s. I speak Spanish fluently. This was a patient.
Go, girl.
What does she not do?
I don't know.
Versus, I'm going to thank my mom for that one, but my grandparents. But she, from culturally, because culture plays a role in this too.
Huge,
right?
huge.
I am saying it's so complex. It's not cut and dry. And, we had to have a conversation about what it was, how it is. Her needs weren't being met at all by her partner. So bringing in the partner, and this was in an OBGYN's office, which, at the time they're like, what are you doing? Why
so cutting edge.
Yeah, I know.
Ooh, look at you go.
Like you can't have a conversation with one and not the other.
Right.
I mean, last time I checked, it took two, right?
Yeah. Unless you have a Bob.
Not much Bob. But, so having...
Bob's the builder.
See what I'm saying about the rabbit hole? We're going to go right down here. Bob the builder. She's going to...
the builder, they will come. I all the things.
But I love it. No, but those are the conversations that we should be having with our patients, right? Again, there's no time. It's just the complexity of women's health. And I love doing that, coaching my patients through it, talking with them, giving them pointers, teaching them that, you may need to take a mirror and look at and look at the clitoral hood to make sure you don't have anything impeding you from the inability to have an orgasm. There's so much that goes into it. So I'm very passionate about that. And I that's what I try to pass on to my patients. I don't try. I do.
You do.
I do.
You do. You do. I'm one of her patients. I'm here to testify.
Honestly, I hope, and I'm sure they do, but I do hope the women that you have treated and spoke to value you for how you need to be. I mean, your crown needs to be like a 3-meter crown, because I can tell you it is something in the sense that women, it is cultural too, but it's also then like a religious type of thing also, and there's a lot of shame and stuff. So if they just feel like, oh, I guess I'm not, sex is dirty. Sex is just for my partner's satisfaction. However, culturally, religious background, anything, you have all of that going on in here.
Biopsychosocial.
Correct. Yeah.
And you don't want to talk to anybody. I couldn't even imagine talking to anybody. So the fact that you started the conversation to me is just so, to say the word empowering again, but it's just so liberating that there's another woman telling you, look out for yourself. Yeah. Get a bottle, bring your partner in, get a mirror.
Yeah.
That's Jersey.
Yeah.
Mirror.
Mirror. I heard it. I love it. But that's what we should be doing, right? I'm going to tell you, I am so blessed because I have a mother who, I'm first generation Cuban American. So my mom was born and raised in Cuba. My grandmother, my great grandfather was an OBGYN. My grandmother was very open. Now listen, born and raised Catholic, very very religious, but we're also human, right? Like this is part of being a human being and a person, right? Like
we all got here the same way. We are all leaving the same way. There is no reason to allow anybody in between to pass judgment on us because we're all going and coming from the same place.
That is so cutting edge because nobody
really thinks that way.
My mom is 81 and she has always been so open about, hey, let's talk about this. Like this is life. This is how it is. My grandmother was very much that way. Like all my mom's friends growing up would go to my grandma and say, hey, I think I started my period. What is this about? They wouldn't even go to their own mother. Right.
My mom swears every time she got pregnant, she was sitting on a toilet. So,
oh yeah. Yeah.
It would be immaculate conception.
The acceptance that they felt and not judgment.
Right.
Coming to your grandmother as opposed to their mother who would have just said, oh, it's fine. Just deal with it.
She's drink some water. Have a good day.
I had a patient again in the community that I worked in. She was Hispanic and she came to me. She goes, I haven't been to church in 3 years. And I said, oh, why? What's wrong? I didn't know what was going on. And she goes, well, because I was on birth control. And I said, what? I had to think about that. I was like, I was born and raised Catholic. I understand. Right. But I was like, why? I was trying to piece it together. I was like, please explain this. And she goes, well, because, being Catholic, you don't understand. I said, I totally understand.
I get you.
I totally understand. And she goes, well, I just haven't gone to church. I said, last time I checked, and then we went into a religious talk.
Sure.
But because sometimes patients need that, right? But the other thing is I told her, I said, you were protecting yourself from an unwanted pregnancy. Mm-hmm. Mm-hmm. Your religion, I understand the Catholic Church isn't going to pay for the kids' college if you get, you know what I mean? So there's so much work to get to a lot of barriers, right? That we still need to
break through,
to help patients through, right?
Yep.
And I tell, this is part of being a sexual medicine provider. Having a good sex therapist is so important. And there's sex therapists out there. Go to ASECT. You can go
we have one on Menopalz.
You can find one, and
nobody would ever think that, you know what I mean? Because that is I never got a sex talk. My sex talk was, my mom said, if you go to the movies, never put the popcorn in between your legs. And I'm like,
well, I mean, sage advice.
like on it, yeah. And keep your eyes open and your legs crossed. And I'd be like, what's happening?
Yeah.
And so I made sure I was like your grandmother and your mom, like with my children, like they would be like, oh my God, mom, are you going to say? And I was like, listen, sex is very important in a relationship. Like you want to have this zoo. That's what I call it. I'm like, you need this zoo. And they were like, oh my God, here we go again. And I have a son and a daughter, and they would look at each other like, oh God. And they would like try to, and I was like, oh no, listen,
Yes.
it's very important. You need to be satisfied with your partner. And they were like, are you done? And I'm like, yeah. And that was like, when they were high school, college, and now that they are adults, now that, they do appreciate
now they appreciate it.
Now they appreciate it.
Listen, I'm still like, anybody who needs a condom? Who needs a condom? Just make it rain.
I had one of my girlfriends back home. Our boys, our two oldest, grew up together. They went to different schools, but they grew up together. And she texted me one day. She goes, they were in junior high. She said, I think I need you to have a talk with the boys. And I was like, wait, what did my boy do? What did my boys do? One was in 7th grade. The other one was in 5th. So I'm like, God bless. She goes, no. She goes, I want you to set up a presentation and talk to these kids and show them what this is about. I said, okay. I said, well, this is how I do it. I got to have permission slips. I'll set up the slideshow. The parents can see the slideshow. And so we did that. The kids, our middle, poor guy, he always had to keep up with his oldest brother. So whatever, I mean, he was younger, but he's mature. He's totally mature. So we got the lecture too. And so it's so funny because till this day, they will tell you, oh my God, my mom brought out the slideshow, like the STDs, what can happen, the cost of having a kid back in 2012 on a minimum wage job.
Oh, that's a really good angle. I didn't actually talk about the minimum wage job. I should have. That would have probably prevented a few pregnancies in my kids' lives.
Yeah. It's having those conversations and invite. I mean, it starts at a younger age. It should.
Yes,
right?
it does. It does.
It does. And it encompasses the whole, like you're saying, like with women, you have to look at a woman, the whole picture.
Absolutely.
Religion, like their beliefs. Like if somebody thinks that being on birth control is like a bad thing and she's shameful, talk about that, because that is what's going to carry on.
Or if they're not comfortable with HRT.
HRT and maybe I shouldn't. And what, like those barriers, if they continue to stay, you'll just be siloed in your whole entire life.
Agreed. Yeah. Agreed. So those are some very important conversations to have with patients as a whole, especially when we talk about sexual medicine, right? Sexual desire. I love what I do. And I love having these conversations and just seeing patients who really transform, right? Like when they come to me, they're just like, I don't even know who I am anymore.
Right.
Yeah.
And then we work together, and then all of a sudden they're like, oh my gosh, like I'm feeling myself again. Like my family has noticed a change. That's what we want, right? That's what we
want. And I truly, I mean, honestly, girls, I have totally enjoyed listening to this. I know the women out there did, because I know what you're doing in your clinic with your Women's Institute. People should rush there, because and rush to Menopause and to find the support, because like we've been there. We're not going to judge. I mean, we are all experiencing. We're experiencers. You know what I mean? We're going to be like, yeah, I don't have that, but
I should have a T-shirt on right there that says like "been there."
Yeah, done that. Been there, done that. Yeah. But, and another thing that I do want to add is, and we see this a lot, providers should not put in their bias.
No.
And they do.
I know.
I had a patient who told me that. She goes, yeah, my provider said she wouldn't prescribe me hormone replacement therapy because she doesn't believe in it and she doesn't feel she didn't need it, so her patients don't need it.
I hear that more often than not, to be honest with you. And I don't know if it's because of the black box label. I don't know if it's because there's lack of education. Maybe they didn't take the 3-hour electives. I don't.
That's the 4 days.
I don't know.
Program's
But
different.
I'm
The
like, I
15-minute
think you need to,
electives, like, yeah.
I think things like get a second opinion. Like a second opinion is where it's at. You know, if you have 2 or 3 people telling you the same thing, then okay, I get it. You know, maybe they're onto something, but get a second opinion always. Always.
Sometimes it does take, again, like I tell my patients, you have the right to hire and fire any provider you want,
Yes.
including myself. So, and within reason, right? Like,
Correct.
don't go to
Everything. Use common sense.
but we should be having these open conversations with these patients,
Yes.
and say, you know, let's try to figure this out together.
Yeah.
We can figure out, we can come together and come up with a plan that's gonna help you, not no.
Because it
Right.
benefits everybody. You know, if there's people out there like, oh, it's just women. No, because it affects everybody. It
Everything,
affects your household,
everybody.
your
It does.
partner, your spouse, your children. Like, it affects everything.
The kids that we get the administration at your kids' school, so you're not cussing them out every day. Your insurance company, so you're not cussing them out.
So it's like that saying, like, happy wife, happy life type of thing. You know what I mean?
Yeah.
Like, everybody should want to have like an understanding or just help during it. It affects everybody.
It does, but also, so I'm going to add to what you're saying by it affecting everybody. We, as women, wear so many different hats.
Yeah.
Oh yes.
Right. And I say this all the time.
Yeah.
We are a mother, a wife, a daughter, a friend, a sister, a niece, a granddaughter. We wear a worker.
Yep.
You know, we wear all these hats. We go through this transition in our life that makes us feel like shit.
Yeah.
And we're expected to do it with a smile on our face. But people don't understand the symptoms that come along with that, the anxiety, the lack of sleep, the palpitations,
and the embarrassment to say that out loud. I mean, I remember crying because the gardener cut down my neighbor's hollyhocks, like crying. I had like a whole day, like I went into mourning over this, like for what, you know, but it's the embarrassment of having that conversation and saying that to somebody. Like, I cried all day because my neighbor's gardener cut down their hollyhocks. Like,
right. Because I think that we have the opportunity. It's our generation. Right here. We have to be the ones to change it for the younger girls, because our generation before us, they did go through it silent. They didn't say anything. They were still like, you know, if they, you know, were stay-at-home moms or whatever, like they were still focusing through. Like my mom, she was like, it was a dark time. What in the hell does that mean? What?
You know what that means?
It's a dark time, but what happened? Yeah, you know. Well, it was not. I mean, I went through it. Yeah.
Imagine she didn't have the support. It was
my God, I can't imagine.
So she was feeling like shit. She didn't have any support. She was probably crying in her closet.
Give me anxiety thinking about it. I'm serious.
But but think about it though too. This is why providers sit there and say, okay, well, here's an SSRI, right?
Right.
Okay, that may not be part of it though.
Right.
That may help, but maybe we need other stuff.
Yes.
Right. So for a lot of women, it was a dark time. And like, I remember my kids, and I do this for a living, for God's sakes. I had my kids saying, Mom, why are you so sad? Or why are you always so mad?
Yeah. Yeah.
And you can't, and you don't even really have answers. You're just kind of like, like, why are you freaking out? I don't even know why I'm freaking out. I'm sorry. I have no idea. And now we have like learned tools. Like, okay, I'm having a freak out mode. I need a few. And they know, like, okay, she would spaz out. So just leave her alone. You know?
But it is something that, and the more people, and that's why, like, you know, it's a silent word, you know, because you talk at work, like literally, I feel like at work, they think, oh, there's the menopause woman. Cause I tell everybody, like I make everybody when I'm in the operating room. And if I forget something, I tell everybody, I'm like, hey guys, you're all in the brain fog with me. Let's get through it.
We're in the haze.
And they're like, I don't know, Mayor, what did you just say? But you bring it out there because the more you do and the more you make it a regular word, not something that needs to be hushed or ashamed of or shame or anything, the more help that it will be for the younger.
Absolutely. Absolutely.
Right. And I know I have a daughter.
Recognizing that there's hormonal shifts that can happen well beyond. If I hear one more time, you're too young, what does that mean?
Yeah.
Because women can have ovarian insufficiency syndrome, and that can happen late 20s, early 30s. That's not too, if their ovaries aren't working,
right.
You're going to really say that to somebody, oh, you're too young? No, like you want to find and that's what I try to do. That's what I do. I find the root cause of what is going on.
Ding, 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 the root cause.
Root cause, right? Let's figure this out. That's what I like to pride myself in is to have that conversation with women and say, let's figure this out. Let's figure out why you're feeling like this. Maybe it is as easy as just having some estrogen and progesterone on board. Or maybe it's a diver deep that we need to, maybe there's some deficiencies going on.
Yeah.
But letting women know this happens. This is going to happen to you, regardless if you want it or not. It's going to happen.
Exactly. And that's what I say. Like, this is not, it's the Game of Thrones. I used to watch Game of Thrones, and literally from like season 2, it was like, winter's coming. I was like, okay, winter's coming. That's what I feel like with menopause. Like menopause coming.
Yeah.
Like, prepare for it, because the more knowledge you know, the more prepared you will be.
Exactly.
And everybody's menopause journey or perimenopausal journey is different. Like their symptoms are different. They, but being able to recognize those as a provider and looking at a patient's age and listening and believing, which I always tell, colleagues, listen and believe to what the patient's saying. Man, you could just sit there and say, maybe this is perimenopause or menopause. Let's see, right? Even if blood work's not going to tell me much, let's see. At least we can do a thyroid function and a pituitary function to make sure that those things aren't off. If they're not, then guess what? Most likely it's perimenopause.
Yeah.
Right. So, yeah.
Well,
Anyway.
I think this was so informative.
Thank you.
I think I might have a girl crush on you, Giselle. I think we're going to have at least a monthly podcast with Giselle.
Let's do it. We can pick topics and
we can totally. Yes, let's dig into symptoms.
It seems like it's so informative. Like, now we talked about like how you got here, how your journey is. And I do think it's something like, you think, oh, well, will we be able to talk for an hour? Yeah. Yeah. Because there's so many. So I think it's so helpful. And then that's like the trilogy. Like, people can listen to it when they're on the treadmill. They can look you guys up on the web, and it's like, they will feel, oh, I have support everywhere I go.
Yeah.
So,
and that's the goal, because we want women to feel supported and like they're not losing their shit along this path.
Yeah.
Because you're in there, ladies. You're in there.
Yep, you are. And who you were, I mean, am I the same person I was in my 20s and 30s? No.
I'm not.
What I want to be, though? No. I really want to be.
My feet couldn't handle those high heels anymore.
Oh, God, I know. Oh, but they were fun. Not gonna lie.
And pretty.
They were. But you will find who you are. Like,
absolutely,
who you are and who you're meant to be at this point. So that's all we can hope for. And we will all find it again, because we're going to have you on again.
Awesome.
Get my date book out.
Well, I know. I appreciate being here. Mara, I think, what you're doing and getting voices out there and informing women is so important. Raquel and I are working together. I mean, I guess I can say it because you said it. I mean, you're one of my patients. So
yes, I did say it. I am one of her patients.
So we can say that.
Yes.
But, working together though, as well, just to to give that extra support to women. And it's out there. If it's not us, there's somebody
There
else.
are other places you can turn to.
Yes.
Yes.
You just have to look around too, because like a provider, you may not find one that the first one you find may not be that.
You might kiss a few frogs.
Exactly.
Yeah.
Absolutely.
Yeah.
And I always encourage patients too. Hey, reach out, like ask questions. You know, if there's questions, maybe we can answer those and lead you in the right path or lead you down a different path. Somebody that is going to be a good fit for you. I had a patient, she was emailing me back and forth. She goes, I just need to make sure we're a good fit. I said, absolutely, I agree. And she goes, well, I'm sorry, I'm sending so many emails. I'm like, I'm not. Let's talk.
Yeah.
Like I want to make sure that this is a good fit for you, right?
Yeah,
Especially
absolutely.
if we're going to be investing in your health, we have to make sure this is a good fit for you. So
correct. Well, perfect. Yeah, it is like finding that perfect shoe fit as we went back to heels. Like, you know, you got to keep trying them on.
If the shoe fits.
Yeah. The shoe fits.
Yeah. Well, again, I thank you guys. I thoroughly enjoyed this. And I know
thank you.
And listening well. And we will all reconvene in another month and talk about something else.
We're welcoming any topics. If you girls, if there's ladies out there that have things you want to talk about or you want us to talk about, please message us on Menopalz, get on the YouTube and put some information out there. Anything you want to hear, we'll talk about it.
I think that's perfect. So I say thank you again. And as I always like to say, I will see you next Tuesday.
Bye.